Данный ролик размещен исключительно в ознакомительных целях. Есть вероятность, что атропин может вызвать нежелательные побочные эффекты, особенно при его долгосрочном использовании. Применение атропина или других лекарственных средств без должного медицинского контроля может привести к негативным последствиям. Все лечебные процедуры следует проводить под наблюдением квалифицированного специалиста.
Talking all about atropine eye drops, and specifically how atropine eye drops can be used as a form of eye floaters treatment. Now, to be specific and very clear, they're not really an eye floaters treatment, they're not a cure for eye floaters, but they can be a way to reduce eye floaters symptoms. And I say that because it's not really affecting eye floaters inside the eye, instead they're changing really how you can see those annoying drifting spots side to side all day long. And I can think of at least 3 reasons why eye doctors usually don't prescribe this, or why I don't think it's quite as popular yet, but we'll get to that toward the end of the video. But in general, atropine eye drops work by affecting your parasympathetic nervous system, and this causes your pupils to dilate really big. And this is important in the eye clinic because we can utilize these drops to really open up the eye and allow your eye doctor to look inside, detect different diseases that could be going on, and to even help relax the eye muscle inside the eye called the ciliary body so that we can get a more accurate prescription, especially when considering doing eye surgeries or anything like that. But usually eye doctors don't use atropine in the eye clinics very often anymore because 1% atropine is incredibly strong, and if your eye doctor did put that in your eye, they probably didn't like you because that makes your pupil dilated for like an entire week. Usually in the clinic now we use derivative forms of these eye drops called tropicamide, or another one called cyclopentolate, because they only work for a few short hours at a time and they usually achieve enough of a desired clinical effect to get our job done. However, atropine eye drops are still prescribed as an alternative to patching therapy for kids with amblyopia or lazy eye. It still gets a good clinical effect, it's just an alternative for kids who just don't want to keep wearing a patch all the time. Also, there's a lot of cool research in using diluted atropine for myopia management or myopia control, which is a way to help slow down the advancement of nearsightedness, myopia in young children, but that's a whole other complicated topic, and I do plan to have a whole video series on that. So again, if you're not subscribed to the channel and you don't want to miss that, make sure you are subscribed again so you'll be alerted when that comes out. Now, the whole idea of using atropine eye drops to relieve these eye floater symptoms is that by giving a really diluted form of atropine, you can get the pupil of the eye to dilate just a little bit. Just enough to help relieve symptoms without causing nasty side effects. The whole idea of how this is supposed to work is that you have these eye floaters, which are suspended in the vitreous humor inside the back of the eye. And then all the light which you are seeing around you day to day, that's casting that image onto the retina, but the floaters get in the way, and so they cast a shadow onto the retina, and that's why you're seeing those squiggly lines move back and forth. I know it's funny to hear how some people say it looks like either small worms or it looks like little bacteria or parasites swimming around. I always think that's great to hear. Mainly because I myself have had those same thoughts, especially as a young kid. I was like, what are these things I'm seeing around here? I even thought sometimes it was just my contact lens being dirty and things like that. But the idea of using the atropine, especially at a low concentration, it would allow your pupil to dilate just enough so that you let in a little bit more light, which will disperse the shadow and making it not so concentrated into one spot so you don't see the floaters as easily. And at least one published report that I read from the European Society of Cataracts and Refractive Surgery found that in, I think, 38 different eyes that they studied, about 70% of the people who used a 0.01% atropine eye drop had a significant improvement of their floater symptoms. And then another 20% had just mild reduction in their symptoms, and only about 10% of these individuals, although it was a smaller study, said they didn't really notice any benefit from it. Now, of course, using any medication, there are potential side effects, especially with the stronger 1% atropine dosing. In those cases, doctors always have to worry about increased heart rate, or what's called tachycardia. We have to worry about urinary and constipation issues, as well as flushing of the skin and altered mental status, interestingly enough. But usually with these smaller 0.01% atropine, so a really small percentage, there's really no reported complications other than occasional allergies to the surface of the eye. It is also possible at a really weak concentration that atropine eye drops could reduce your accommodative ability. That's again your ability to focus on your object. So if you're somebody who has either a reduced accommodative amplitude to begin with, or if you're somebody who's approaching like 35 to 45, you may start to have more difficulties focusing on your objects like your phone. You may have to reach for reading glasses earlier, things like that. But still all very valid things to be concerned about and something that doctors have to weigh and consider when prescribing these medications. Now, if you're wondering if using atropine eye drops is going to work for you and your floater symptoms, it's of course something that you need to talk with your eye doctor about, but there still may be some challenges in you getting this eye drop in order to even give it a try. Namely because most eye doctors aren't really utilizing this. This is again something I've seen more anecdotally either across the internet or hearing some other doctors kind of trying it out for some patients who are very symptomatic. And the reasons why I don't think this is very popular is one, it's not something generally discussed in the training when you're becoming an eye doctor, whether you're an optometrist or an ophthalmologist. It's just something that doesn't really come up. It's not widely studied or widely published. But hopefully because there are so many people with floaters and they're just frustrating people and people are looking for an alternative treatment outside of surgery, if you're not a good candidate for surgery or something like that, this may be becoming a better option. I think the other two reasons why it can be challenging to get this is because some doctors are either, because they're just not super familiar with it, they may not feel comfortable giving it a try, or it mainly because 0.01% atropine is difficult to get. 1% atropine is usually pretty easily obtained through any general pharmacy, but getting a 0.01%, a highly diluted formulation, needs to be acquired through what's called a compounding pharmacy. And unfortunately, compounding pharmacies are just something that's not readily available in every community. So in order for an eye doctor like myself to prescribe a low-dose atropine, you have to find one of these special pharmacies, begin a conversation with them, make sure that pharmacy is either available there for the patient to go pick it up, or that pharmacy can mail it directly to the patient. And it's usually a lot easier said than done, and thankfully maybe something that is becoming more popular going forward in the future. And I can speak directly from the experience at our clinic where we do use compounding pharmacies to help get low-dose atropine for myopia management or myopia control for children. So I think if you are trying to find a doctor in your area that may be able to prescribe low-dose atropine to try it out for you, and if this is going to help for you and your floaters, you can certainly call your clinic ahead of time and ask if it's something they do, if they work with compounding pharmacies. But chances are, if your clinic does myopia control or myopia management for young kids, they likely will have access to a compounding pharmacy to get low-dose atropine. But again, I can't speak for all eye doctors out there. Not every eye doctor may feel comfortable in prescribing low-dose atropine for you, especially if they haven't heard of kind of these studies or anything like that.
Если информация в этом ролике была полезной для вас, и тема ДСТ является актуальной, пожалуйста, не забудьте подписаться на наш канал. Также у нас есть телеграм-группа, где активно обсуждаются вопросы, связанные с деструкцией стекловидного тела. Спасибо всем за внимание.